My name is Isaac Davis Jr., and I am a student at the University of Arizona Global Campus. I'm currently taking Psych 7510 Biological Psychology. We're going to be talking about a great topic tonight, and I'm really excited to present this to everyone. I'm also excited about this topic because this is something that has personally affected me. I have had issues with, or challenges, I should say, with panic attacks, which is a form of a mental illness, since I was a teenager. So we're going to look at the effects of Paxil. It's a closer look at how it impacts us individually. We're also going to look at what is Paxil, why is it prescribed to patients. We'll also look at some of the effects of Paxil, as well as some of the dangers of using Paxil. Panic attacks is a major mental illness. When one thinks about a panic attack, one thinks to himself, how many people actually suffers from a panic attack? Have you ever wondered about that? Well, statistics shows that 1 in every 75 person suffers from a panic disorder. So those are some high numbers. And panic attack has been correlated with being a serious mental illness. Now, the exact cause of what causes a panic attack, we're not sure. But statistics and data has shown that there's a strong correlation between panic attacks and a major life transition. Now, major life transition can be very stressful. There are things that can trigger someone to have a panic attack. An example of that could be graduating from college. You got 2 classes left, 3 classes left, very nervous that you're going to pass the class or you're not going to pass the class, can cause a trigger panic attack. A new mother who has had difficulties in her pregnancy, and she may have had miscarriages in the past, and she's very stressful that she wants to carry this baby to term, that can cause panic attacks when something goes wrong. So there's an array of things that can cause one to have a panic attack. Now, panic disorder have been linked to genetic disposition as well. So that means if your family member has panic attacks, more likely that someone that you may have panic attacks as well. And these are data from the American Psychological Association. When you think about it, having a panic attack is very scary. I myself have suffered from panic attacks, and when it first started, I was a teenager, and I didn't know what was going on. You're talking about almost 35 years ago. So the 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 level of knowledge that we have now versus back then um, is night and day. So I had no idea what was going on. I I felt like I was having a heart attack. I was very nervous. It was just, I just could not grasp why was I having these episodes, and I couldn't control them. And then when my doctor suggested to me to take Paxil, she would say this is a treatment that could help with your panic attack. Now, Paxil is, or as the generic brand is, paroxetine, is used to treat a variety of mental illness, including panic attacks, but also it treats depression, over obsessive compulsive disorder or OCD, anxiety disorder, and post-traumatic stress disorder are some of the things that Paxil is used for. Now, the medication may help you feel better. It may also help you to sleep better. You might begin to eat more and you begin to have more energy. Because when you're depressed, when you have panic attacks, you just don't feel like doing those things. You can't sleep, you can't eat, you're nervous all the time. So this medicine is a way to help you get back into the swing of things around the house and to kind of normalize um, your emotions. Fear, anxiety, unwanted thoughts, and the number of panic attacks may, when taking Paxil, may reduce as the treatment continues. And compulsions such as washing your hands all the time, counting, any kind of OCD type of disorder may decrease because of taking this medicine, the Paxil. So, what is Paxil? So, Paxil, in its simplest term, is an antidepressant that belongs in a specific group called the SSRIs. Um, what Paxil does is that Paxil affects the chemicals in the brain that may have become imbalanced, which is causing people to have depression, anxiety, and other disorders. Primarily, Paxil is used for depression or any other major depressive disorder, but Paxil is also used for panic attacks, OCD, anxiety disorder, and PTSD. So Paxil is a drug that has many functions that helps balance the unbalancing that's going on in someone's brain. Some things that I want to mention about Paxil is that before you begin taking Paxil, you always want to make sure that you read the medication guide. There's also a patient information label that comes when you get your medicine by the pharmacist. Also, you want to read that just to be sure that you understand all the effects and the uses for this medicine. And you want to ask your doctor or pharmacist if you have any other questions about the medicine. Your doctor will tell you how often you should take it. So it'll tell you should take it once a day, twice a day. The doctor will inform you of that before you begin um, taking the medicine. Also, think about this before you take the medicine. You want to see how it's going to affect you because a lot of times, if you take medicine on an empty stomach, it may upset your stomach. So your nausea may be lessened if you take the medicine with food or a glass of milk or even a full glass of water. You want to consult your physician about taking this medication at nighttime. Maybe you feel better taking it at nighttime during the daytime. So if you're having problems taking it during the daytime where it's making you sleepy, drowsy, to talk to your doctor, and so your doctor can discuss the best course of action for that. Um, you want to also inform your physician or pharmacist of all the medications that you're taking. So it's very important that you let your pharmacist or your physician know the medicine you can take it because there's some prescription that does not interact well with this medicine. So you want to make sure that you don't have any problems um, in that area. Also, the doctor may get there and the doctor may suggest to you take a lower dosage if if you're if you're starting to feel a lot better and your panic attack is starting to subside. So those are things that you want to consider um, while you're taking the medicine. And also, even if you feel fine, um, you do not want to just stop taking the medicine. You want to consult your doctor first before discontinuing the medicine. If you suddenly stop taking the medicine, you may risk having your condition worsen because your body now your brain it has gotten used to being balanced based off of the medicine, and then you abruptly stop. It can have some major negative impact on your brains. And again, If you start feeling, if you start having some issues from taking the medicine, and we're going to look at some of the possible side effects from taking the medicine in the next couple of couple of slides. But if you start having some problems with it, you want to make sure that you talk to your pharmacist or your doctor immediately, so they can make recommendations on how to proceed from that. So, like again, you should never stop taking your medicine. A lot of times people who are start taking the medicines, 'cause I know, for instance, when I started taking Paxil, I was still having panic attacks, and I was even wondering, is this medicine working? Now you have to remember that when I took it some 30 years ago, the medicine was brand new, so it was just out on the market. So so there was little known about the medicine. Although the FDA was studying the medicine for years, but it was still, in its infancy stages. So it was incredibly frustrating for me because I'm taking the medicine and I'm still having some panic attack. So experts have said that there's a possibility that it could take up to several weeks for someone to reap the full benefits of this medication. So don't fear, and again, don't stop taking the medicine because it is working. Now, in case if your condition does not improve or it worsens, again, you want to notify the doctor. But I just wanted to reiterate that it can take up to several weeks to reap the full benefits from taking Paxil. Now, you should definitely stop taking Paxil if you have an allergic reaction. Um, allergic reaction. Now, again, I mentioned earlier that if you're taking certain medicines, you should not um, take Paxil. One of the medicines is Promazine or Thyrodorazine are two of the medicines that have a negative impact with Paxil. So if you're taking either one of those medicines, you should not be taking Paxil. Um, and then you just want to make sure that you're just discussing with your doctor again all the medicines that you're taking so that the doctor can make sure that there won't be any problems when you interact that medicine, your medicine that you're taking, with the Paxil. And also, very important, you want to make sure Paxil is safe for you to use because you need to tell your doctor if you have some of these problems. If you have heart disease, high blood pressure, if you had a stroke in the past or just recently, a lot of times you need to let the doctor know, especially if you had liver or some kind of kidney disease, any kind of blood clotting or disorder. You want to let the doctor know so they can make the recommendation of whether you should take this medicine or have an alternative. You have seizures or epilepsy, you need to let the doctor know. Bipolar disorder, or you need to let the doctor know. No. Another thing that you need to let the doctor know, if you have a drug addiction, you know, because you may misuse the medicine and not use it for its purpose. You're supposed to take it orally. Some people may get there and decide to snort the medicine through the nose, which is, it's not definitely not recommended, and it's abusing the medicine for its use. Um, if you have suicidal thoughts or sexual problems, you need to you let the doctor know because Paxil, may interfere with that. And then just if you had low levels of sodium in your blood, is another thing you should let the doctor know before he or she prescribes that medicine for you. Now, some of the side effects of Paxil, and you should definitely seek immediate medical attention if this happens to you. If you have a severe skin reaction, um, if you're itching all the time, if you have swelling or difficulty breathing or some kind of high breakout, then you need to consult with your physician or your pharmacist, so they can make recommendations of what to do. Your doctor should know about any new or worsening symptom, such as your mood or your behavior may have changed, um, or you're still having panic attacks after taking the medicine for 3 or 4 months, or you having difficulty sleeping, or you just feeling very impulsive. You should definitely let your doctor know about that. And then also, some other more serious issues include if you're starting to have blurred vision, tunnel vision, you starting to have pain in your eyes, swelling in your eyes. If you're starting to see halos around lights, then you definitely want to talk to your physician or your pharmacist about the Paxil usage. Um, if you start to have unusual bone pain or very tenderness around there, swelling or bruising, talk to your doctor. And that is the thing that I want to reiterate. You always want to talk to your doctor or your pharmacist if you're starting to have any of these things happen to you. It's just very important to be proactive. Some other side effects of Paxil could changes in weight. Someone may have a weight gain, an increased weight gain, severe nervous system reaction, um, such as rigid muscle, high fever, sweating, confusion, um, are all possible side effects of taking Paxil. So you want to again consult with your doctor or your pharmacist if any of these things are. And again, you want to talk to your doctor if any of these symptoms occur. Like I said earlier, just the vision changes, the weakness, drowsiness. If you're feeling very drowsy during the daytime from taking the medicine, then you may want to talk to your doctor about possibly taking it at nighttime. So that might be a possible solution. If you're having shaking or your anxiety seems to worsen, you want to talk to your doctor. Sleep problems, loss of appetite, or if you're starting to have nausea, vomiting, diarrhea conditions, dry mouth, these are all other symptoms that could be side effects of taking the Paxil. And then you're just having extreme headaches, it's another thing. The most important thing is that you want the side effects should alleviates, over the period of time. But if it doesn't, you definitely want to talk to your doctor. But in conclusion, I believe that the outcome of having a balanced mind outweighs the side effects that could occur. I thank you for taking the time to watch this video with me, and I hope you learn a little bit about the Paxil and its usefulness, how it uses to alleviate um, brain activities, uh, causing negative thoughts, anxiety, and then some of the possible side effects of Paxil. Thank you very much.